Well, it has been more than a year that the first case of coronavirus was reported here in Arizona. Maricopa County, all too familiar with the challenges of this pandemic. According to data from Johns Hopkins, only one other county has more confirmed COVID cases than Maricopa County.
But there is hope on the horizon. I spoke exclusively with Dr. Rebecca Sunenshine, Maricopa County's top doctor, about what she's seeing and what everyone living here needs to know. Here's part of our ABC 15 Health Insider conversation. Maricopa County, home to nearly 4.5 million people and more than 500,000 confirmed COVID-19 cases over the course of this pandemic. The valley hit hard by the coronavirus, but through the darkness of 2020, there are glimmers of hope in 2021. What trends are you noticing currently with COVID-19 here in Maricopa County?
That our case numbers are continuing to trend downward from a peak in early January. We're also seeing a downward trend in our hospitalizations and thankfully our deaths related to COVID-19.
But Dr. Rebecca Sunenshine, medical director for disease control at the Maricopa County Health Department, says there are still so many unanswered questions.
They have been steadily going downward. It looks like they may be leveling off, but it's really too soon to say. And we're still not exactly sure why they trended down when they did, but we're grateful to see this trend.
Especially when we factor in those variants, like the one from the UK, which scientists say can spread even faster. According to the CDC tracker, Arizona has more than a dozen confirmed cases.
Some experts are predicting that there may be an increase in March because of that strain becoming the predominant strain in the United States. So we don't know if there will be a third peak, but the most important thing that we can do right now, even though the case numbers are declining, we still have a lot of transmission here. We're still in the red zone, and we want to make sure that people keep wearing their masks, wash their hands, stay home when they're sick, avoid large groups, and importantly, get the vaccine when they can or are eligible to get it.
How concerned are you, Dr. Sunenshine, about those variants? Are you worried that these variants could somehow derail all the success we've made?
I don't think that it will derail all the success. I think what we know so far is with the UK variant, and that's the one that's most likely to spread and is more contagious. It doesn't necessarily cause more severe disease. It's just more contagious. We know that it responds to the vaccines that we have available. So the vaccine is still very effective.
And the vaccine is still our best way out of this health crisis and into herd immunity. Dr. Sunenshine says roughly 1 in 5 adults in Maricopa County has received at least one dose, with around 20,000 adults getting vaccinated daily. But the process hasn't been without challenges.
Maricopa County is so geographically large, they have to travel very far to get there. That makes it challenging for people without transportation, and that's why we're working so closely with the state to make sure that we have ways to transport people to the pods, and also that we're bringing these smaller vaccine events to vulnerable communities who may not have transportation.
We also spoke to Dr. Sunenshine about the Johnson & Johnson vaccine and how that could expedite this process. She told us they're expecting to get their first round of doses sometime near the middle of this month. The county also told me on Thursday, that last week they did 25,000 vaccinations. That's actually more than they thought they would. The ABC 15 Health Insider team is here to answer your questions. Email them to healthinsider@abc15.com. We also have a section on our website with other Health Insider Q&As as well as stories. Just head to abc15.com/health.